Professors of medicine across the nation will host yet another virtual meeting this evening before making public their final decision on whether or not to join the current medical walkout by tendering their resignations. Our Choi Soo-hyung has the latest.
Professors from 24 of South Korea's roughly 40 medical schools will decide whether or not to collectively hand in their resignation letters. So far, among the so-called Big Five hospitals in Seoul, professors of Seoul National University, the University of Ulsan, and Catholic University have finalized their decision to submit resignation letters if the government takes any legal action such as suspending junior doctors' licenses. According to an emergency response committee of professors formed on Tuesday, they will finish discussions by Friday to show support and to safeguard junior doctors who walked out around 4 weeks ago. The health ministry on Friday morning urged the medicine professors not to resign.
The government once again urges the junior doctors to come back to the field for the public and for their co-workers. Doctors can be respected when they stay with the patients.
Some of the general hospitals which filled vacancies left by the departure of most junior doctors with professors are now under emergency response measures. Seoul National University Bundang Hospital is now operating surgeries only for emergency, severe cases due to the lack of doctors, and the number of surgeries has decreased by about 30% to 50% compared to before. In Friday's briefing, the government thanks those medical personnel who stayed at their workplaces.
While the severity and emergency indicators in the medical field are stable so far, the government is considering the public's inconvenience when using medical services and the exhausted medical staff still doing their duty very seriously.
The current conflict between the government and junior doctors was sparked by the government's plan to increase medical school enrollment by 2,000 places starting in 2025. Doctors insist that an expanded quota cannot be a fundamental solution to break long-standing issues like a shortage of essential medical services such as pediatrics, obstetrics and gynecology. The government said the quota increase is inevitable, as South Korea currently has just 2.6 doctors per 1,000 people, far below the OECD average of 3.7, and that it is needed to resolve regional healthcare disparities. The government has unveiled the allocation plan for the new quota on Thursday, with 80% of new med school spots going to schools outside the capital region. Choi Soo-hyung, Arirang News.